Testing internal rotation, also known as medial rotation, against gravity position. You'll have your patient in a prone position with her arm hanging off the table. You will have your patient perform full internal rotation to the best of their ability. So go ahead and do that for me, please. There we go, let it back down. Because she was able to do that, that is a grade 3. Go ahead and go up about halfway for me, please. Okay, I'm going to stabilize the scapula and push down on the forearm. Now, note again, I'm crossing the elbow. This is one of the few exceptions you will be doing this with. So go ahead and resist me. 3, 2, 1. There we go. Testing internal rotation, also known as medial rotation, gravity eliminated position. Patient will be in a prone position as shown here, shoulder once again hanging off the table. You'll first have your patient perform internal rotation to the best of their ability. So go ahead and do that. Yep, just like that. Okay, then you're done with that. Because she was able to do that, that is a grade 2. If she could not do that, then I would palpate right here for the subscapularis and the teres major. If I feel these muscles firing, that would be a grade 1. If I do not feel them firing, that is a grade 0.